And Congresswoman Lawrence, thank you very much for joining us here on the MegaCast.
Oh, thank you so much for having me on. And I just want to say before we start talking, for everyone, please be safe. We are going toward the middle of this epidemic and hopefully start seeing the downside of this. We have been struggling with this going uphill, and I think the better days are ahead.
Well, I appreciate that message of optimism. I agree. I agree. And, let's add one other little optimistic message here as we get going today. How about the heroic work of just everybody? I mean, almost everyone seems to be complying with these tough orders that we all know that we have to deal with. Our first responders, amazing. Our medical workers, amazing. And we could take the whole show just listing off all the people that have come through. Doesn't that make you feel good about America?
It's through all of this heartbreaking experience, it has been so refortifying me as a citizen of this great country. There people who we normally just kind of walk past, we now see them as heroes, like the cashier at the grocery store, the postal worker, the custodian. We are now looking at them as our heroes because things that unfortunately society have said, oh yeah, they do that because they can't do anything else and you don't see the value in them. We now see our nurses, I mean, you can't say enough, and home care providers, those who are working in nursing homes and going every day into homes of those who cannot take care of themselves to take care of them. And how about the food delivery drivers? Whoever thought we would look at them as a hero because they're bringing food to our homes. So this has been to me a moment for America to stop and just reevaluate what's important to us. And I hope this continues.
Congresswoman, are we getting what we need here in Michigan to get through this from the federal government?
It has been a struggle. I will not deny that. It has been a struggle. But what Michigan has done, like so many other states, we have learned how to uh, find the resources and make it happen and not point fingers, but say, okay, if we can't get it from the federal government, we'll, through the compassion of so many wealthy businesses who gave their private jet and flew to China, who flew to Italy to pick up medical supplies. And the nurses who, we have students who hadn't completed their medical training who are stepping up in that official capacity. We've had retirees come back to work. And so we have seen the Hyundai who contacted me and said, we want to help. And donating $100,000 and gave us 10,000 rapid response test kits. It has been just unbelievable, the pouring out of compassion and the ability for us to just lock arms and say, everyone has a piece of this. The TCF, the Suburban Center, those are not, Suburban Center is not a government building. And a private owner said, we're going to open this up for us to expand beds and take care of people. So we learned a lot through this. And one thing I want the public to know that has been extremely troubling for me is our lack of ability in the United States to supply our own medical needs. Almost all of our PPEs are manufactured and shipped to the United States. There should be a number, and we are pushing for this, manufacturing opportunities for entrepreneurs to come in to make surgical gowns, to make face masks, to make gloves, the cotton swabs. We didn't make any of that here in the United States, so we were held hostage. And we learned a lot through this, but I'm just so impressed with the generosity, the compassion, and it's like one no doesn't stop the show. You just that's a no. So let's find the yes. And I've seen a lot of that with our governor, with our mayors, with our first responders to, figure it out. Who thought you could wash a face mask and sanitize it and reuse it? And who thought so many people would bring out their, their sewing machine and start making masks? So we learned a lot through this.
Well, we have, Congresswoman. And, I just want to go back to your comment. Matters of international trade are complex in
Yes,
our country. They are complex. They get partisan. It's difficult to find consensus. And you work in a body that I'm not so sure is designed to easily get to consensus, just in its structure. But that said, maybe a good starting point. I really like what you said. Maybe a good starting point is to say, you know what, medical supplies that are critical to sustaining life in the United States should be manufactured in the United States. Is that something we might see out of Washington?
absolutely. Absolutely. We went through, and some of us are old enough to remember when we went through the whole oil situation, and we were so dependent on oil that was imported into our country. And now we're saying we can supply the oil to ourselves. We changed our philosophy and said, what do we have here at home? Um, we cannot and should not ever be in this situation again where we are dependent and on other countries. And because this was a pandemic, so many other countries were going through the same thing. And so you had stock materials for PPEs, which was our biggest crisis, ventilators and PPEs, personal protective equipment. And a lot of people, a lot of companies rolled up their sleeve, thank God, and just started. How do we manufacture this? What materials do we need? How do we make it? And something that was really interesting to me were cotton swabs. I mean, really? We grow cotton in this country. We know how to manufacture anything, and we didn't have that. So things will change. I agree because I'm pushing for it.
Well, that's really good to hear because, that seems like an issue that Democrats and Republicans and the president could certainly all agree on, don't you think?
I've said that before. I hope so.
Okay, well, I appreciate it. I hope you take some leadership on that. How is the issues that we're facing here in Michigan, the big numbers that we're facing, is that being recognized in Washington? And do they know how much trouble that we have gone through here? I know we're coming out, but do they understand the severity of what's going on? Have you been able to communicate that to folks in Washington and get us what you think we need?
The good thing about this are the numbers and the facts. So when you start, as you know, every day they show the number of deaths, the number of contamination, infections. And we have, for the last month and a half, been the third highest in the country, which they use the term a hot spot. So we've had, unfortunately, the the title of a hotspot, and the numbers are real. And the deaths have just been just overwhelming. And the other thing that came out of this was how this virus was impacting the African American community. And I want to talk a little bit about that because when we went to the medical community, everyone gave a reason. So we are African Americans, we're infected more than others because of underlying conditions, blood pressure, diabetes, heart disease. Um, and there was some, then it was kind of like, yeah, that's why they're dying because they have all these issues. We must take from this, every tragedy gives you an opportunity. We must take this as an opportunity. Why does the African American community, Hispanic community, Native American community in this country have so many underlying conditions? And a lot of people talk about it's a result of poverty. It's a result of food deserts. It's a result of lack of medical care. But whatever it is, in these United States of America, it shouldn't just be well, that's why they're dying. It shouldn't be. It was our slap in the face that we have some issues in our community that we need to address, because it's not acceptable to have disparities in our health care. And so that's the governor stepped up and she said, we're going to, in Michigan, we're going to start a task force and study this because it's not acceptable for 14% of our population to be infected at 38% and at for the people who die from this disease, 40% African American, and then next was Hispanic. And so we have some work to do. Um, and it's just not acceptable to say
No.
that's our norm in America.
U.S. Representative Brenda Lawrence joining us on the MegaCast. She is on Zoom. If you're watching us, if you're listening on the radio, it's great to hear your comments, Representative. Earlier in the show today, we talked to Mayor Waterman from Pontiac, and she said, and others have said, that it would be a really good idea to start tracking the metrics on African Americans so we can see the numbers. We see the deaths. Now we're starting to see the successes, people getting out of the hospital. I think that's good.
Yes, thank
That's really
goodness.
nice to see that. But she said, and others are saying, and I'd like your opinion. Maybe we should track minority communities so we see the metrics, so we have the numbers, so we can react. Your thoughts?
So you can't fix anything unless you can define the problem. And that's the challenge we have. We know the results, but we have not defined why are we here? What is this about? And one of the other glaring issues that came up, there were some medical facilities, some health organizations that are not tracking the deaths and the infections by race. And so you saw the ones who did, and it was so disproportionate. Then you got this unknown group. So who are the unknowns? And a significant number in the hundreds. So we are, one of the things we're doing on a congressional level, as I'm a member of the Congressional Black Caucus, is to demand the CDC and the Center of Disease Control and the Health Department, HHS, to track all of any epidemic, pandemic by race. And that's when you can have the numbers. So 3 things we've asked for is that every medical facility, when they're filling out the paperwork, that they have a race box. So then we can actually see the real numbers. And then secondly, is that there is a report made to the public so that we know what those numbers are. It shouldn't be a secret. And then third, and this is for me is so important, what's our plan of action? How are we going to address that? I will give you an example. Deaths by automobile crash. How do you think we came up with seatbelts? How do you think we came up with airbags, car seats for our babies? It's because there was medical information that said when a child sits in a seat and it is propelled, when a seatbelt doesn't fit a baby, you have to get the data so that we can begin the healing process and reducing this disparity in our country.
Our representative in Congress, U.S. Representative Brenda Lawrence, joining us. I hope you're doing okay on time. I appreciate all the time you're taking for us and with me and in particular our audience. Good to have you with us. So you say that's really interesting what you just said about seatbelts. I think it's a wonderful analogy. So the current equivalent to that in this environment is washing our hands, putting the masks on, all these things. Are we going to be able to take this toolkit and apply it to get back to whatever the new normal is? Do you see that, and do you have any thoughts about what the next steps are going to look like?
So I'm really encouraged by the number of people who have gone home and stayed home, and I know people are getting stir crazy and they're kind of getting cabin fever. I'm sitting in my home. I've been sitting in my home for over 3 weeks now. I had to fly to DC to vote. It was extremely stressful. But when I got on the plane, it was only 6 people on the entire plane. So social distancing was not an issue, and there was no one in the airport. However, I don't see a time in the immediate future where we go back to hugging and shaking hands and having that just social contact that we normally do. But washing your hands, sheltering in place, social distancing, the mask, the gloves, because we don't know how it's transmitted. And a lot of people who are saying, this is ridiculous, it's too much. It's too much because we can't tell you that if we stay 6 feet apart, we will never have to worry about getting the disease. We don't know how long it lives on a surface. We don't know if we touch a shopping cart, if the virus is still alive. We don't know if you hand me a plastic bag and you don't have on gloves, is the virus on that bag? So until we can get there, because right now we're trying to keep people alive. The research is happening, but we don't have those answers. So if you feel this is too much, thank God it is, because it is working, because we're starting to see a stabilization. And I know some people say the governor is just overdoing it. She's just doing too much. I thank God she is, because to me, that's a sign of the government having the compassion to say, we will do anything possible to keep people alive. And I ask people to please just have some patience. My husband and I were talking about this with my granddaughter. Think of the reality that we have a home that we can shelter in. There's homeless people. There are people who have all kind of issues with housing. One of the things that I want people to know, my priorities was a water shutoff and utility shutoff moratorium. So if you're telling people to wash their hands and to to be able to shelter in place and there's no water in the house, we need to put a moratorium on this until this pandemic is over. Secondly, also fighting to make sure that our municipalities are funded, that they're getting the money, because you just heard the mayor of Detroit, which I represent Detroit as well. And he's saying that, they're losing revenue. The casinos was a major contributor to their tax base. And then companies that everyone's laid off. So taxes that you normally pay on food and products have been reduced tremendously. So we are looking at, and then the postal workers. So many people take that for granted. I was a postal worker, and they come to your house every day, and they're losing money because people are not, the businesses aren't working, so they're not sending mail out. And so they're reducing their revenue. And so we have to keep the postal service afloat. In addition to that, we're talking about voting by mail. If you have no postal service, how are we going to protect our democracy?
Do you
Because
see?
if
Do you
this
see, Congresswoman?
continues,
Do you see? Sorry to interrupt, but do you see a situation where we are going to be able to help out? The federal government will help out Michigan, will help out Detroit, will help out the postal service. I agree with you. I think you're right on target. But I don't think people realize how difficult this budget is going to be to work out in these municipalities, right down to our local municipalities. And unlike the federal government, they cannot operate at a deficit. You want to talk about that?
so the other group, before I answer your question, are the hospitals. The hospitals are just being overwhelmed. All the tax dollars is goes through my committee, and we have to allocate it. We have to take the budget and allocate the funds. As you know, you can't print money, and we are properly, and thank God we are able to do it, to provide stimulus checks, to give loans to small businesses who need it. In addition to that, we did give a small amount of money to the Postal Service. They're going to need more. We did the CARES Act, where there's stimulus dollars being given to all working employees. Unemployment has been enhanced. And we're trying to create this financial bridge for America so that they can stay afloat until things go back and, we can go back to work. With that being said, we still have all of our bills, all of our plans to what makes America, America, the programming that we fund. In addition to that, something that a lot of people don't realize, SNAP, which is a food service, has for the poor has been enhanced. The food lines are just really breaking my heart around the country. People are without food. But with that being said, we're going to do a CARES Act 2, and we're scheduled to go back to DC the first week in May unless things change. It's a plan. So we haven't been confirmed, but we're looking at May 5th to go back to Congress to vote on the CARES Act 2, which we know that one-time payment may not be enough. The checks are just starting to come out this week, and we know that there will be no employment or no work until we're going to look at it again the first week in May. And so there may be a need for another series of checks to be mailed out to the communities, and some more grants or loans to the small businesses. Because, if you were an ice cream store or bakery and you've been shut down all this time, and you're not going to be able to turn the switch on and everybody start running back and doing everything as normal. I know I'm cooking more than I ever have. It is amazing to me how often I ate out now. I'm realizing it. And so I'm cooking more, and I probably will continue some of that. I'm going to be a little nervous to just go into a restaurant sitting next to a table with another person till we get a better handle on this pandemic. So there will be heated discussion about how much money we can afford to continue, and what not so much afford, but what we need to contribute to the community to keep everyone alive, fed, and able to take care of their families.
Well, Congresswoman Lawrence, I appreciate that. I appreciate your honesty, too. There will be heated conversation and debate in Washington, but, there was on the CARES 1, and Democrats, Republicans, President all came together. I just want to let you know how important it is, because that's what I like about this show. We are totally on the front line talking to people every day. These stimulus checks do make a difference. I could tell you my own business, because I operate a business. This is just something I started up to do. I've got 20 employees, and we applied for the payroll protection plan, and because I have a relationship with a bank, I finally got my number today. So, I think I'm going to be okay. I think we're going to get our check. But, there are a lot of... Well, and I don't know yet. I mean, and I hear the funding is going to end tomorrow. So I was like, I didn't sleep last night, because I got 20 employees. I want to make sure that they all continue to stay employed. I've not laid anybody off. We want to keep them working. And I read story after story after story of other businesses that are doing the same thing. And then the people that come on the show, they need the check. So I'm glad to hear that you guys realize in Washington that we do need this CARES too. A ton of people didn't get access on the small business side, the government, the post office, everybody else. So you think we're going to get there with that? You say there'll be heated debate. Do you think we'll get what we need?
Yes, it is. Right now, the debate is about, do we use our funds to keep businesses afloat? Do we use the funds to take care of the citizens with another stimulus check? So, that was the discussion last time, and we were able to come together and do both. And I think that is where we need to be. The crisis has lasted longer than we thought. And so we need to do both. We need to take care of the citizens. We need to take care of our business community. And so we need to do both.
President says that each state will, he talked yesterday in his press conference. We could talk about his press conferences for an hour. We're not going to do that. We're not going to do that on this show, because we're just trying to solve problems. I don't want to create problems. But he said that, I hope we take him at his word. He said that, he's going to let each state determine when they open back up. Does that sound like a good plan to you?
Absolutely, because every state is not the same. Um, so, to give you an example, even within a state, let's take South Dakota. South Dakota has a hot spot in the state, and there's a large part of the state that there are no cases of a virus of anyone being infected. So every that's why it's important that every governor determine, because in South Dakota right now they're trying to contain it so it doesn't spread. And that's the problem. When you just lift it and everybody's able to go back to business as usual, then the spread starts. Because I'm gonna go visit my friend, I'm gonna go do this, and I'm a carrier. And then I give it to you, and then you go see your family and you give it to your family. That's the challenge. So every governor who has all the data should be able to assess how important it is and to have certain restrictions and how it's available to open up certain things. One of the complaints I heard about the governor restricting travel to your vacation homes in Michigan, when you get up north and get to the rural communities, they don't have a hospital every 5 miles like we have here. And our hospitals were overwhelmed. Can you imagine if so many people have homes up north and just prefer, with all this stress, to get away and go somewhere up north on some water, and we're carriers, and we start spreading it in those little small towns, that would have been devastating. And so thank goodness she had the wisdom to say, wait, everybody stay home, shelter in place.
Yeah, she's taken some. I get it. She's taken some heat for that one, Congresswoman Lawrence. She is taking some heat for that one. Do you see that we'll get to a point, maybe even before the summer is over, when we can go up north? I mean, that's what we do here in southeastern Michigan.
Yes,
we go up north. Hi, Dave Lorenz from Travel Michigan on. You probably know Dave. And he said, well, the one thing he said is we're not spending a lot of money promoting to the nation. So when we do come back, Michigan people need to travel in Michigan, and that makes a lot of sense. But do you see that we're going to be able to get in our cars and go up and spend a weekend on the lake?
I am so optimistic that we will be returning back to some form of normal, which includes traveling to our vacation homes up north. Just that we don't have to have a home. It's kind of a tradition in Michigan that everybody kind of goes up north during the summer. In addition to that, I see a time where I'm so concerned about our children being out of school. Our children need to go back to school. I have a granddaughter who's in college. And so many of the parents are at home, and that has to happen because there's no childcare. If the parents go back to work, there's no school, and there's no childcare, then that's chaos. So a lot of things have to connect before we open up the doors and get back to what we call normal.
Yeah, that's what is gonna. We got our hands full. You have your hands full. The governor has her hands
Yes.
full. The state legislature has their hands full. Our president has his hands full. We all got our hands full. This is gonna be. It was hard enough making the decisions to shut it down, but as I look at it, just one observer, Congresswoman Lawrence, I think it's going to be a little bit harder to figure out how to navigate the waters to open it back up.
It's not going to be easy at all, because just like the situation with the children, that was just a check the box because everybody's at home. It's your child, they're in their home. And this is another thing I'm working on, is access to broadband, to internet. Pray that you had internet at home so you could still use the established curriculum to educate your child. But that's not a reality in every home. That's another issue. But the fact that we knew children were safe because they were with their parents was just one of those check the box. And nurse and daycare centers and nursery schools were closed as well. So now when we open back up and we tell people go back to work, where are the children going to be?
Yeah, that's
tough. That's just one of the questions.
It is tough. I want you to know, I know you already know, but I want you to know we've had virtually all of our superintendents in our area on the air over the past several weeks. You know what they're doing is heroic. They're feeding kids. They're continuing to maintain the education.
Yes.
You know, can you talk about why? I know you know the stories. I know you've been talking to people. Can you talk about, just for a minute, and we'll let you go, but can you talk about the schools and the way they are stepping up to the plate in this whole thing?
You know, the educators, there's never a vacation for the educators. So many children. The reality is the best meal of their day, and sometimes the only meal of their day, is in school, when they're in school. And so that was one of the things that we discussed and debated on the Hill. We have to fund food programs, especially for our children. So SNAP and other school programs, not only do we need to educate our children, we have to feed them. And so we did allocate funding to feed our children through school programs. And few people know that a lot of the schools have summer programs to feed the children when they're out of school during the summer. So we felt good about that because they already had a process and the ability to feed children when they're not attending school every day. So we infused more funding into that program so that the children could be fed. And it's the social challenges we have just been so amplified during this. Homelessness. Where do you, when you tell a homeless person to shelter in place, what does that mean? In Nevada, let me tell you how cruel it was. On the ground where homeless people sleep, they put markers of 6 feet. So, you know, this is your.
Yeah, it appears we've lost our connection with Brenda Lawrence for just a minute. Congresswoman, we got you back. Go ahead. You're talking about Nevada. Start again, please.
Yes. I was saying, and this is your 6 feet to sleep on the street. Homelessness, children being fed, our nursing homes where we had to shut down communication, our lack of personal protective equipment. Who are these people that we're calling the frontliners? We've learned so many lessons in our social, sometimes insensitivity to those who people just walk by every day. It has become, when did we think a custodian in a hospital was a hero or shero? Because they're cleaning and allowing our nurses and doctors to be able to operate in an environment and our patients to be in an environment where they won't be contaminated. And right now, the custodians are one of our frontliners. And so we've had to learn some hard lessons during this period.
All right. Well, Brenda Lawrence, thank you very much for joining us. We are in good hands with you in Congress. I know you're working real hard. I know you care. I see you out in the community. You are out in the district an awful lot when we are doing that kind of thing. And I appreciate you taking all the time you took with us today. We don't ask political gotcha questions on this show. I am kind of curious, though. Can I ask one question before we say
Yes.
so long?
Yes.
Is the governor going to be our next vice president here in the United States? Think she's going to run?
Well, I know she is. She's rising in value. I can tell you that she has been so impressive during this pandemic. She's shown leadership skills. But there's a lot of amazing names on that list, and she has said she wants to be our governor. But it's a chance of a lifetime. So I can tell she's a serious contender.
Yeah.
Before I leave, I can't
Yes,
leave
please.
without saying thank you. Thank you to everyone what you do, like the custodians cleaning the hospital, the UPS and FedEx drivers who are delivering medications and things to our home, the postal worker who we see every day. I want to thank the grocery store or the restaurants who are providing curbside, who are staying open to provide food. It's just so many thank yous. And thank you to Michigan for staying at home, for us fighting together by wearing our masks, our gloves, staying at home to stop the spread. I can't thank you enough. And I just want everyone to know that this we will get through together. Mental health is very important to me, and I know this has been so hard on so many people. The deaths, oh my goodness. I know so many people who have lost loved ones. They can't have a funeral to grieve. They are they can't visit their loved ones to have that closing expression of love and appreciation for their lives together. That's life changing. So we have a lot of work to do, but I want you to know I hear you, I see you. Um, and for those who are stressing about getting to their home up north, think about those people who have lost their loved ones, who could not have a funeral, who could not even say goodbye to them. We got to start counting our blessings. The fact that you're healthy and you don't have this virus is something for us to focus on this time. And this sacrifice is short. It's short, but it's so necessary. So to everyone, please be safe. And I tell everyone, I'll see you soon.
All right. Thank you very much, Congressman Brenda Lawrence of the 14th District. Thank you very much. Taking so much time from your home here in the district. Very good to talk to you today on the MegaCast. There she is. She took an awful lot of time for us. It's greatly appreciated.